This is Takoa Rogers, family nurse practitioner student at Albany State University. This will be my video for my pediatric infant assessment. This is Moana. Moana is a 6-month-old infant, and today she's in for her well check. And she lives with her mom and dad, and her parents report no problem since her last visit. And her mom states that she is sucking well and is rooting for her bottles well, and her level of activity is pretty much appropriate for her age, and she is seen reacting to toys that are placed in front of her and observes things in her surroundings. So these things let me know that her neurological status is appropriate. With her general appearance, Moana is clean and she is neatly groomed. Her mom doesn't report any issues, says that she is taking up to 10 ounces of formula with every feeding, and she feeds every 6 hours while she's awake, and she does sleep throughout the night. Mom also reports that she takes baby cereal with blended fruit and vegetables that are mixed in. She is appropriate at that age for introducing solids. Her behavior for her age is appropriate and developmental wise. She is alert, and her mom reports that she is also reaching for objects if they place them in front of her, and she smiles spontaneously and is also babbling. For her growth and measurement, we're going to check her length, and we would check that with a measuring tape. And generally, I like to put our tape down to get a better reading. If the child is on some type of paper on the bed, then I would mark the head, top of the head with my pen, all the way down to the sole of the feet with my pen, and generally pick the child up and measure that length. Then we would also do a weight on the child. For her being an infant, she would be weighed on a bed scale. An infant scale, just place the infant or place her on the scale and try to let her be still, hands off the scale to get an accurate weight. We would also check the head circumference. With the head circumference, we would do our measuring tape and we would go under the occipital area and get midline and wrap our tape like so to get a head circumference measurement on the child. We would also check her chest circumference as well, also with a tape, and we would do this in the same manner. Go under, and we would go under the arms, and we would assess here to the mid-thoracic to gain that measurement. And for vital signs, we'll check Miranda's heart rate. Heart rate of 120 is within desired limits for her at 6 months old. Respiratory rate 32, and temperature. To get an accurate temperature, we would do a rectal temperature and 98.7, which is also within desired limits for her. For her skin, we're going to check and look over the skin. Her skin color is normal for her race. Her mucous membranes are pink. If we look while she's got her mouth open, we'll see that the mucous membranes are pink as well. Her skin is very smooth. She doesn't have any rashes, lesions, or discolorations, and her skin is also warm and dry when we touch it. For the nails, we would also look here at her fingers, check the nails. We would see that they're smooth with no ridges. They're also clean. Her hands are very clean and neat. For hands and feet as well, we would look at her palmar creases in the hands. We would look at that to see if they are symmetric, and as well as being in the centers of the hands and don't go all the way across. Don't see any deformities with the hands or the feet. Lymph nodes, we would check here. Start behind the ears and feel down through the neck. We could also do axillary as well to check for lymph node there. Don't want to feel any enlargement or movements of the lymph nodes, and we don't. And we would check her head and her hair. Her hair is very thick. It is a dark black color. Has a curly texture. It covers her scalp completely and is evenly distributed. No infestations are seen or any other abnormalities there. Her head is normal cephalic. It's symmetric with her shoulders and also with her trunk. Her head sits directly in the middle. She's able to hold her head sturdy while looking at objects, which is normal for a 6-month-old and expected. There are no deformities of her skull. Her fontanelle is soft. There's no sinking or bulging noted there. Her scalp is clean and atraumatic. No scratches or bruising or discoloration. No lumps or bumps are noted there as well. Then we will move down to her neck. Feel her carotids. We will do those one side at a time. Also feel the trachea to see that it is midline with no deviations. Her neck is symmetric with her head as well as with her shoulders, and there's no deformities there. So then we will move on to her eyes. We will look at her conjunctiva to make sure that those are moist and pink. They're moist and pink. There's no drainage, no redness, and no type of edema noted there. We will look at the whites of her eyes, see that her sclera is white with no redness, no swelling there. We would take our pen light and we would want to look at her pupils. They are equal, round, and reactive to light. We would also want to note that she's able to fix her eyes on objects. We can hold something in front of her, and at 6 months old, she should be able to follow the object with a fixed gaze and see that while it moves. Her outer eyes are symmetric to her face. There's no deformities to her eyes or her eyelids. Then we will move around to her ears. You look at her pinna, see that her ears are aligned and symmetric. We will look at the alignment from her eyes to her ears as well to make sure that that is also symmetric. There's no draining from her ears. There is nothing abnormal coming out of the ears. And when we make sounds, she would easily turn her head to the side of the sound, whether it be left or right. And when we look in the ears, we will use our otoscope, and at 6 months old, we're going to pull down and back to assess her ears. And when we look in the ears, we're going to look at the tympanic membranes here to make sure that they are normal. They're going to be pearly and gray with no redness and no edema. No discharges noted in that inner ear. And we would also look at the cone of light in her left and right ear as well. For her nose, we're going to also look in the nose. We can shine our light in there and look at the mucosa, make sure that there's no drainage or no swelling there, no discharge, and that her nares are patent and she's moving air easily. And also look at the septum to make sure that it's midline. And then we would move down to her mouth and to her throat. We'll look in her mouth when she opens and laughs. We look in to make sure that our mucous membranes are moist and pink there. We can put one finger in to assess and feel of the palate to make sure that it is smooth and has no swelling and no irritation to it there. We look for discolorations. No discolorations. There's no eruption of teeth at this age for Moana. Her mom states that she is sucking and swallowing well with no difficulty. And we would also look at her tongue while we're looking in the mouth, and we would see there's no coating or no abnormalities on the tongue as well. Then we move down to her chest, and you want to look at her thorax. Her thorax is appropriately shaped and proportioned for her body and her size, and she has an even rise and fall of the chest with her respirations. We would also listen to her lungs. And for Moana being 6 months old, we're going to use the bell of our stethoscope. If we don't have a pediatric stethoscope, we will use the bell, and we're going to listen in all fields of her lungs. And we're going to listen to make sure that the lung sounds are clear. They are clear with no wheezing or no abnormal sounds noted. And we would count her respiratory rate as well. We can do that with the stethoscope, or we can sit and just watch as she plays and count the respiratory rate, and it's even and non-labored. And then we would move on to listen to her heart. You want to listen to her heart sounds. You would listen to her aortic sound, and then we would listen to her pulmonic, and then we would check the tricuspid, and then we would move on down to the mitral and listen to those heart sounds as well. For the vascular area, we're going to check our pulses. We will check the carotids, again, one at a time, one on each side. And then we can move down to check her brachial pulses, which would be in the arms. We can check her radial pulses here, check her femoral pulses, and then also her popliteals and the dorsalis pedis here. We would check down in the foot. We're going to check for capillary refill as well in the toes and in the fingers, and it's 1 to 2 seconds. And then we're going to move down to her abdomen. We want to listen to her bowel sounds, and we're going to listen to that in all 4 quadrants. Mom states that she is having normal bowel movements, no straining, and no constipation is reported from Mom. And then we would check her musculoskeletal system as well. We want to look at her joints and want to make sure that everything is bending and there's no deformities or no swelling in any of her joints. We would also check her hips for symmetry. We can hold her up and make sure that they are symmetric when she is up, and then lay her flat as well. The knees extended, and also flex the knees to make sure that her hips are symmetrical. And the ortolani maneuver should be performed, and that would be able to assess for dysplasia or any deformities in the hips. And that concludes our assessment.